Hi, my name is Erin DeFranco, and the title of my capstone project was Occupational Therapy Within the Senior Community Low Vision's Influence on Social Participation. I did my capstone experience at Ohio Living Breckenridge Village, and I had access to long term care residents, assisted living residents, and memory care residents. However, I did most of my experience with the long term care residents. Next, I'm going to talk a little bit about the population in need. So, specifically to the US older adult population, there are 56 million Americans that are age 65 and older. With aging comes a higher risk of having health concerns. Nearly 95% of older adults have at least one chronic condition, and nearly 80% have two or more. And then, more specific to the problem of low vision, 4 million Americans are affected by low vision in the older adult population. And with the number of older adults on the rise, there's also an increase in low vision diagnoses. In 2022, there were nearly 500,000 new diagnoses. Low vision and blindness are also expected to more than double in the next 30 years, with more than 9.5 million people living with low vision. So, due to this rapidly increasing population of people with low vision, it is important to have resources that both support and enhance social participation while accommodating to the low vision concerns. I had four main goals when I was at Ohio Living, and the first one was to collaborate with Ohio Living during social events, activities, and programs to better understand the factors influencing social participation specific to low vision. So, to do this, I was present for all activities and I paid special attention to people with low vision concerns to see how that was impacting their social participation. I had another goal of developing a handout with low vision suggestions for common social events to increase social participation. My third goal was to publish this handout. And then the fourth goal was to complete a continuing education course on OT's role in low vision. So, my major accomplishments while I was at Ohio Living were I created a low vision accessible activity booklet for the residents. So every month, the activity staff would hand out an activity booklet for the residents. However, it wasn't low vision accessible. The font was really small and it was pretty light print. So it was hard for people with low vision concerns to read. So I made a handout and booklet for those residents with low vision concerns that had bolder and bigger fonts. And then I completed a CEU course called An Introduction to Low Vision Rehabilitation for Occupational Therapists. And then I created a low vision handout that was accessible for staff and family members, which you can see here. So, really encouraging bigger, brighter, bolder, and decreasing glare during activities so that residents with low vision can better participate and it will be more meaningful to them. And then I also led low vision accessible jumbo print games with the residents once a week. So for that, I planned games that were accessible to them by making fonts bigger. I used jumbo dice and did different things like that. So, reflecting back on my capstone experience, it was really evident throughout observation and working with the residents directly that without proper low vision techniques, residents with low vision concerns definitely have lower social participation, and they don't want to participate in activities that they think are going to be difficult for them or embarrassing for them. But with education and adaptation and using different techniques that will assist with their vision, they were able to partake in more meaningful social activities with their peers and ultimately increase their social participation. As far as future plans go, I really hope to advocate the importance of addressing low vision concerns throughout my practice. And then I want to obtain a specialty certification in low vision, and I also want to continue taking low vision CEUs. And then lastly, here are my references. Thanks for watching.